Preservation rhinoplasty is a method of nasal surgery that has really taken the world by storm, especially over the last few years, because it's a perfect combination of structural improvement to the nose for aesthetic change, as well as minimal invasiveness, which is always desirable with any type of surgery. So when we combine these ideas of optimal aesthetic shape, being able to give patients the full spectrum of beautiful and aesthetically attractive noses, as well as minimizing the invasiveness, then we're really combining the best of both worlds. What is preservation rhinoplasty and how is it done? It's basically a method where I'm working through small hidden incisions inside of the nostrils, gaining access to the underlying cartilage and bone framework of the nose, and then modifying that framework using techniques such as push-down and let-down methods, which refers to addressing a dorsal hump where I'm shaping that dorsal hump, reducing the dorsal hump without actually removing it, without cutting it off, which is the traditional method of dealing with the dorsal hump. Instead, what we're doing is disarticulating or separating the components so that the hump can shift downwards. That's called dorsal preservation because we're preserving the intrinsic structure of the bridge of the nose, but without removing tissue. Tip preservation is also a method of shaping the cartilages that make up the tip structure in a way that preserves the intrinsic support, the intrinsic stability of those structures, and that's the minimal invasive component of it. It's hard to really visualize these methods, but just know that preservation rhinoplasty is an important aspect of the full spectrum of rhinoplasty techniques, and because it combines optimal aesthetics with minimal invasiveness, I've really incorporated it into my practice of closed rhinoplasty methods. Closed methods are really critical to minimize invasiveness, which speeds the process of healing and recovery, also minimizes the risk of complications, as well as preservation methods, which minimize the removal of tissue, instead working with the tissues to shape and sculpt it optimally. We can get really beautiful results for patients who are ideal for preservation rhinoplasty, and of course, it requires a consultation in order to determine what's going to be the best technique to use for your anatomy and goals.